Emotionally focused therapy, Wikipedia audio. Emotionally focused therapy and emotion-focused therapy are a family of related approaches to psychotherapy with individuals, couples, or families. EFT approaches include elements of experiential therapy, systemic therapy, and attachment theory. EFT is usually a short-term treatment. EFT approaches are based on the premise that human emotions are connected to human needs, and therefore emotions have an innately adaptive potential that, if activated and worked through, can help people change problematic emotional states and interpersonal relationships. Emotion-focused therapy for individuals was originally known as process experiential therapy, and it is still sometimes called by that name. EFT should not be confused with emotion-focused coping, a category of coping proposed by some psychologists, although clinicians have used EFT to help improve clients' emotion-focused coping. EFT began in the mid-1980s as an approach to helping couples. EFT was originally formulated and tested by Sue Johnson and Leigh Greenberg in 1985, and the first manual for emotionally focused couples therapy was published in 1988. History. To develop the approach, Johnson and Greenberg began reviewing videos of sessions of couples therapy to identify, through observation and task analysis, the elements that lead to positive change. They were influenced in their observations by the humanistic experiential psychotherapies of Carl Rogers and Fritz Perls, both of whom valued present-moment emotional experience for its power to create meaning and guide behavior. Johnson and Greenberg saw the need to combine experiential therapy with the system's theoretical view that meaning-making and behavior cannot be considered outside of the whole situation in which they occur. In this experiential systemic approach to couples therapy, as in other approaches to systemic therapy, the problem is viewed as belonging not to one partner, but rather to the cyclical reinforcing patterns of interactions between partners. Emotion is viewed not only as a within-individual phenomena, but also as part of the whole system that organizes the interactions between partners. In 1986, Greenberg chose to refocus his efforts on developing and studying an experiential approach to individual therapy. Greenberg and colleagues shifted their attention away from couples therapy toward individual psychotherapy. They attended to emotional experiencing and its role in individual self-organization. Building on the experiential theories of Rogers and Perls and others such as Eugene Gendlin, as well as on their own extensive work on information processing and the adaptive role of emotion in human functioning, Greenberg, Rice and Elliott created a treatment manual with numerous clearly outlined principles for what they called a process experiential approach to psychological change. Elliott et al. And Goldman and Greenberg have further expanded the process experiential approach, with detailed manuals of specific methods of therapeutic intervention. Goldman and Greenberg presents case formulation maps for this approach. Johnson continued to develop EFT for couples, integrating attachment theory with systemic and humanistic approaches, and explicitly expanding attachment theory's understanding of love relationships. Johnson's model retained the original 3 stages and 9 steps and 2 sets of interventions that aim to reshape the attachment bond, 1 set of interventions to track and restructure patterns of interaction and 1 to access and reprocess emotion. Johnson's goal is the creation of positive cycles of interpersonal interaction wherein individuals are able to ask for and offer comfort and support to save others, facilitating interpersonal emotion regulation. Greenberg and Goldman developed a variation of EFT for couples that contains some elements from Greenberg and Johnson's original formulation but adds several steps and stages. Greenberg and Goldman posit three motivational dimensions: attachment, identity, or power, and attraction or liking that impact emotion regulation in intimate relationships. The terms emotion-focused therapy and emotionally focused therapy have different meanings for different therapists. In Lay Greenberg's approach, the term emotion-focused is sometimes used to refer to psychotherapy approaches in general that emphasize emotion. Greenberg decided that on the basis of the development in emotion theory that treatments such as the process experiential approach, as well as some other approaches that emphasized emotion as the target of change, were sufficiently similar to each other and different from existing approaches to merit being grouped under the general title of emotion-focused approaches. He and colleague Rhonda Goldman noted their choice to use the more American phrasing of emotion-focused to refer to therapeutic approaches that focused on emotion, rather than the original, possibly more English term emotionally focused. Greenberg uses the term emotion-focused to suggest assimilative integration of an emotional focus into any approach to psychotherapy. He considers the focus on emotions to be a common factor among various systems of psychotherapy. The term emotion-focused therapy will, I believe, be used in the future, in its integrative sense, to characterize all therapies that are emotion-focused, be they psychodynamic, cognitive behavioral, systemic, or humanistic. Greenberg co-authored a chapter on the importance of research by clinicians and integration of psychotherapy approaches that stated, in addition to these empirical findings, leaders of major orientations have voiced serious criticisms of their preferred theoretical approaches, while encouraging an open-minded attitude toward other orientations. Furthermore, clinicians of different orientations recognized that their approaches did not provide them with the clinical repertoire sufficient to address the diversity of clients and their presenting problems. Sue Johnson's use of the term emotionally focused therapy refers to a specific model of relationship therapy that explicitly integrates systems and experiential approaches and places prominence upon attachment theory as a theory of emotion regulation. Johnson views attachment needs as a primary motivational system for mammalian survival. Her approach to EFT focuses on attachment theory as a theory of adult love wherein attachment, caregiving, and sex are intertwined. Attachment theory is seen to subsume the search for personal autonomy, dependability of the other and a sense of personal and interpersonal attractiveness, lovability, and desire. Johnson's approach to EFT aims to reshape attachment strategies towards optimal interdependency and emotion regulation, for resilience, and physical, emotional, and relational health. All EFT approaches have retained emphasis on the importance of Roche-Ryan empathic attunement and communicated understanding. They all focus upon the value of engaging clients in emotional experiencing moment-to-moment in session. Thus, an experiential focus is prominent in all EFT approaches. All EFT theorists have expressed the view that individuals engage with others on the basis of their emotions, and construct a sense of self from the drama of repeated emotionally laden interactions. Similar terminology, different meanings. The information processing theory of emotion and emotional appraisal and the humanistic, experiential emphasis on moment-to-moment emotional expression have been strong components of all EFT approaches since their inception. EFT approaches value emotion as the target and agent of change, honoring the intersection of emotion, cognition, and behavior. EFT approaches posit that emotion is the first, often subconscious response to experience. All EFT approaches also use the framework of primary and secondary emotion responses. Greenberg and some other EFT theorists have categorized emotion responses into 4 types to help therapists decide how to respond to a client at a particular time: primary adaptive, primary maladaptive, secondary reactive, and instrumental. Greenberg has posited 6 principles of emotion processing: awareness of emotion or naming what one feels, emotional expression, regulation of emotion, reflection on experience, transformation of emotion by emotion, and corrective experience of emotion through new lived experiences in therapy and in the world. While primary adaptive emotion responses are seen as a reliable guide for behavior in the present situation, primary maladaptive emotion responses are seen as an unreliable guide for behavior in the present situation. Johnson rarely distinguishes between adaptive and maladaptive primary emotion responses, and rarely distinguishes emotion responses as dysfunctional or functional. Instead, primary emotional responses are usually construed as normal survival reactions in the face of what John Bowlby called separation distress. EFT for couples, like other systemic therapies that emphasize interpersonal relationships, presumes that the patterns of interpersonal interaction are the problematic or dysfunctional element. The patterns of interaction are amenable to change after accessing the underlying primary emotion responses that are subconsciously driving the ineffective, negative reinforcing cycles of interaction. Validating reactive emotion responses and reprocessing newly accessed primary emotion responses is part of the change process. Goldman and Greenberg 2015 proposed a 14-step case formulation process that regards emotion-related problems as stemming from at least 4 different possible causes: lack of awareness or avoidance of emotion, dysregulation of emotion, maladaptive emotion response, or a problem with making meaning of experiences. The theory features 4 types of emotion response, categorizes needs under attachment and identity, specifies 4 types of emotional processing difficulties, delineates different types of empathy, has at least a dozen different task markers, relies on 2 interactive tracks of emotion and narrative processes as sources of information about a client, and presumes a dialectical, constructivist model of psychological development and an emotion schematic system. The emotion schematic system is seen as the central catalyst of self-organization, often at the base of dysfunction and ultimately the road to cure. For simplicity, we use the term emotion schematic process to refer to the complex synthesis process in which a number of co-activated emotion schemes co-ply, to produce a unified sense of self in relation to the world. Techniques used in coaching clients to work through their feelings may include the Gestalt therapy empty chair technique, frequently used for resolving unfinished business, and the 2-chair technique, frequently used for self-critical splits. Emotion-focused theorists have posited that each person's emotions are organized into idiosyncratic emotion schemes that are highly variable both between people and within the same person over time, but for practical purposes emotional responses can be classified into 4 broad types: primary adaptive, primary maladaptive, secondary reactive, and instrumental. Features: experiential focus. Emotion-focused theorists have proposed that each type of emotion response calls for a different intervention process by the therapist. Primary adaptive emotion responses need be more fully allowed and accessed for their adaptive information. Primary maladaptive emotion responses need to be accessed and explored to help the client identify core unmet needs, and then regulated and transformed with new experiences and new adaptive emotions. Secondary reactive emotion responses need empathic exploration in order to discover the sequence of emotions that preceded them. Instrumental emotion responses need to be explored interpersonally in the therapeutic relationship to increase awareness of them and address how they are functioning in the client's situation. Maladaptive emotion responses and negative patterns of interaction. Individual therapy. Emotion-focused therapy with individuals. Emotion response types. The therapeutic process with different emotion responses. It is important to note that primary emotion responses are not called primary because they are somehow more real than the other responses. All of the responses feel real to a person, but therapists can classify them into these 4 types in order to help clarify the functions of the response in the client's situation and how to intervene appropriately. A therapeutic task is an immediate problem that a client needs to resolve in a psychotherapy session. In the 1970s and 1980s, researchers such as Laura North-Rice applied task analysis to transcripts of psychotherapy sessions in an attempt to describe in more detail the process of clients' cognitive and emotional change, so that therapists might more reliably provide optimal conditions for change. This kind of psychotherapy process research eventually led to a standardized set of therapeutic tasks in emotion-focused therapy for individuals. The following table summarizes the standard set of these therapeutic tasks as of 2012. The tasks are classified into 5 broad groups: empathy-based, relational, experiencing, reprocessing, and action. The task marker is an observable sign that a client may be ready to work on the associated task. The intervention process is a sequence of actions carried out by therapist and client in working on the task. The end state is the desired resolution of the immediate problem. Therapeutic tasks. In addition to the task markers listed below, other markers and intervention processes for working with emotion and narrative have been specified: same old stories, empty stories, unstoried emotions, and broken stories. The interventions and the structure of emotion-focused therapy have been adapted for the specific needs of psychological trauma survivors. A manual of emotion-focused therapy for individuals with complex trauma has been published. For example, modifications of the traditional Gestalt empty chair technique have been developed. Brubacher proposed an emotionally focused approach to individual therapy that focuses on attachment, while integrating the experiential focus of empathic attunement for engaging and reprocessing emotional experience and tracking and restructuring the systemic aspects and patterns of emotion regulation. The therapist follows the attachment model by addressing deactivating and hyperactivating strategies. Individual therapy is seen as a process of developing secure connections between therapist and client, between client and past and present relationships, and within the client. Attachment principles guide therapy in the following ways: forming the collaborative therapeutic relationship, shaping the overall goal for therapy to be that of effective dependency upon one or two safe others, depathologizing emotion by normalizing separation distress responses, and shaping change processes. The change processes are: identifying and strengthening patterns of emotion regulation, and creating corrective emotional experiences to transform negative patterns into secure bonds. A systemic perspective is important in all approaches to EFT for couples. Tracking conflictual patterns of interaction, often referred to as a dance in Johnson's popular literature, has been a hallmark of the first stage of Johnson and Greenberg's approach since its inception in 1985. In Goldman and Greenberg's newer approach, therapists help clients also work toward self-change and the resolution of pain stemming from unmet childhood needs that affect the couple interaction, in addition to working on interactional change. Goldman and Greenberg justify their added emphasis on self-change by noting that not all problems in a relationship can be solved only by tracking and changing patterns of interaction. In addition, in our observations of psychotherapeutic work with couples, we have found that problems or difficulties that can be traced to core identity concerns such as needs for validation or a sense of worth are often best healed through therapeutic methods directed toward the self rather than to the interactions. For example, if a person's core emotion is one of shame and they feel rotten at the core or simply fundamentally flawed, soothing or reassuring from one's partner, while helpful, will not ultimately solve the problem, lead to structural emotional change, or alter the view of oneself. In Greenberg and Goldman's approach to EFT for couples, although they fully endorse the importance of attachment, attachment is not considered to be the only interpersonal motivation of couples. Instead, attachment is considered to be one of three aspects of relational functioning, along with issues of identity/power and attraction/liking. In Johnson's approach, attachment theory is considered to be the defining theory of adult love, subsuming other motivations, and it guides the therapist in processing and reprocessing emotion. In Greenberg and Goldman's approach, the emphasis is on working with core issues related to identity and promoting both self-soothing and other-soothing for a better relationship, in addition to interactional change. In Johnson's approach, the primary goal is to reshape attachment bonds and create effective dependency. Emotion-focused therapy for trauma. EFT for couples features a 9-step model of restructuring the attachment bond between partners. In this approach, the aim is to reshape the attachment bond and create more effective co-regulation and effective dependency, increasing individual self-regulation and resilience. In good outcome cases, the couple is helped to respond and thereby meet each other's unmet needs and injuries from childhood. The newly shaped secure attachment bond may become the best antidote to traumatic experience from within and outside of the relationship. Adding to the original 3-stage, 9-step EFT framework developed by Johnson and Greenberg and Goldman's emotion-focused therapy for couples has 5 stages and 14 steps. It is structured to work on identity issues and self-regulation prior to changing negative interactions. It is considered necessary, in this approach, to help partners experience and reveal their own underlying vulnerable feelings first, so they are better equipped to do the intense work of attuning to the other partner and to be open to restructuring interactions and the attachment bond. Emotionally focused therapy with individuals. Johnson summarizes the 9 treatment steps in Johnson's model of EFT for couples. The therapist leads the couple through these steps in a spiral fashion, as one step incorporates and leads into the other. In mildly distressed couples, partners usually work quickly through the steps at a parallel rate. In more distressed couples, the more passive or withdrawn partner is usually invited to go through the steps slightly ahead of the other. During this stage, the therapist creates a comfortable and stable environment for the couple to have an open discussion about any hesitations the couples may have about the therapy, including the trustworthiness of the therapist. The therapist also gets a sense of the couple's positive and negative interactions from past and present and is able to summarize and present the negative patterns for them. Partners soon no longer view themselves as victims of their negative interaction cycle, they are now allies against it. Couples therapy. Stages and steps. Stage 1. Stabilization. This stage involves restructuring and widening the emotional experiences of the couple. This is done through couples recognizing their attachment needs, and then changing their interactions based on those needs. At first, their new way of interacting may be strange and hard to accept, but as they become more aware and in control of their interactions, they are able to stop old patterns of behavior from re-emerging. This stage focuses on reflection of new emotional experiences and self-concepts. It integrates the couple's new ways of dealing with problems within themselves and in the relationship. Johnson and Sims described 4 attachment styles that affect the therapy process. The emotionally focused family therapy of Johnson and her colleagues aims to promote secure bonds among distressed family members. It is a therapy approach consistent with the attachment-oriented experiential systemic emotionally focused model in 3 stages: de-escalating negative cycles of interaction that amplify conflict and insecure connections between parents and children, restructuring interactions to shape positive cycles of parental accessibility and responsiveness to offer the child or adolescent a safe haven and a secure base, consolidation of the new responsive cycles and secure bonds. Its primary focus is on strengthening parental responsiveness and caregiving, to meet children and adolescents' attachment needs. It aims to build stronger families through recruiting and strengthening parental emotional responsiveness to children, accessing and clarifying children's attachment needs, and facilitating and shaping caregiving interactions from parent to child. Some clinicians have integrated EFFT with play therapy. One group of clinicians, inspired in part by Greenberg's approach to EFT, developed a treatment protocol specifically for families of individuals struggling with an eating disorder. The treatment is based on the principles and techniques of 4 different approaches: emotion-focused therapy, behavioral family therapy, motivational enhancement therapy, and the new Maudsley family skills-based approach. It aims to help parents support their child in the processing of emotions, increasing their emotional self-efficacy, deepening the parent-child relationships, and thereby making ED symptoms unnecessary to cope with painful emotional experiences. The treatment has 3 main domains of intervention, 4 core principles, and 5 steps derived from Greenberg's emotion-focused approach and influenced by John Gottman: attending to the child's emotional experience, naming the emotions, validating the emotional experience, meeting the emotional need, and helping the child to move through the emotional experience, problem solving if necessary. Johnson, Greenberg, and many of their colleagues have spent their long careers as academic researchers publishing the results of empirical studies of various forms of EFT. The American Psychological Association considers emotion-focused therapy for individuals to be an empirically supported treatment for depression. Studies have suggested that it is effective in the treatment of depression, interpersonal problems, trauma, and avoidant personality disorder. Studies have suggested that emotionally focused therapy for couples is an effective way to restructure distressed couple relationships into safe and secure bonds with long-lasting results. Johnson et al. Conducted a meta-analysis of the 4 most rigorous outcome studies before 2000 and concluded that the original 9-step, 3-stage emotionally focused therapy approach to couples therapy had a larger effect size than any other couple intervention had achieved to date. 70 to 73% of couples reported recovery from relationship distress, according to the Dyadic Adjustment Scale measure of relationship satisfaction, and 86% reported significant improvement over controls. Studies have consistently shown clinically significant improvement post-therapy and excellent follow-up results. A study with an fMRI component suggested that emotionally focused couples therapy reduces the brain's response to threat in the presence of a romantic partner. Some of the strengths of EFT approaches can be summarized as follows. Psychotherapist Campbell Pitton, in his 2014 book The Trouble with Psychotherapy, criticized a variety of approaches to psychotherapy, including behavior therapy, person-centered therapy, psychodynamic therapy, cognitive behavioral therapy, emotion-focused therapy, and existential therapy. He argued that these psychotherapies have accumulated excessive and/or flawed theoretical baggage that deviates too much from an everyday common-sense understanding of personal troubles. With regard to emotion-focused therapy, Pitton argued that the effectiveness of each of the therapeutic tasks can be understood without the theory, 124, and that what clients say is not well explained in terms of the interaction of emotion schemes, it is better explained in terms of the person's situation, their response to it, and their having learned the particular language in which they articulate their response. 129. In a 2015 article in Behavioral and Brain Sciences on memory reconsolidation, emotional arousal, and the process of change in psychotherapy, Richard D. Lane and colleagues summarized a common claim in the literature on emotion-focused therapy that emotional arousal is a key ingredient in therapeutic change and that emotional arousal is critical to psychotherapeutic success. In a response accompanying the article, Bruce Ecker and colleagues disagreed with this claim and argued that the key ingredient in therapeutic change involving memory reconsolidation is not emotional arousal but instead a perceived mismatch between an expected pattern and an experienced pattern, they wrote. The brain clearly does not require emotional arousal per se for inducing deconsolidation. That is a fundamental point. If the target learning happens to be emotional, then its reactivation of course entails an experience of that emotion, but the emotion itself does not inherently play a role in the mismatch that then deconsolidates the target learning, or in the new learning that then rewrites and erases the target learning. The same considerations imply that changing emotion with emotion inaccurately characterizes how learned responses change through reconsolidation. Mismatch consists most fundamentally of a direct, unmistakable perception that the world functions differently from one's learned model. Changing model with mismatch is the core phenomenology. Other responses to Lane et al. Argued that their emotion-focused approach would be strengthened by the inclusion of predictions regarding additional factors that might influence treatment response, predictions for improving outcomes for non-responsive patients, and a discussion of how the proposed model might explain individual differences in vulnerability for mental health problems, and that their model needed further development to account for the diversity of states called psychopathology and the relevant maintaining and worsening processes. Stage 2. Restructuring the bond. Stage 3. Integration and consolidation. Styles of attachment. Family therapy. Efficacy. Strengths. Criticism. Notes. EFT for couples. EFT for families. Videos.